Welcome to today's program. Today is July 1st, 2021, if you can believe it. But it's an important day on the calendar for anybody that follows legislative issues or advocacy, because it's the one day of the year where most of the bills take effect that are past the previous legislative session. So it's an important day on the calendar for us policy junkies. So we have a great program set up for you today. Before we dive into that program, I did want to thank our partners on our podcasting platform. And those are our partners at Danna-Gracey, as well as the Florida Orthopedic Risk Purchasing Group. Without their support, the Florida Orthopedic Society and Bone Society of Florida could not provide you this venue and this opportunity for learning and engagement that we've put together today. So I'm really pleased to introduce somebody that probably needs little introduction to most of our audience, Tony Large. Tony has been representing the Orthopedic Society here in the state of Florida for many years. We don't like to say how many years because we don't like to age ourselves. But has been a great steward of our advocacy program for a long time, and is a great advocate for orthopedics and for patients in the state of Florida. So we thought of no one better to bring on today to talk about legislative bills that are taking effect today, July 1st, than Tony. We are going to challenge her because there was quite a few bills that passed this year that will impact orthopedics. We'll let her frame the legislative session a little bit before we dive in. But historically, there's over 3,000 bills that get filed each year, and very few actually make it all the way through the process into the governor's desk and signed into law. So we're not going to cover 3,000 bills today, luckily, but we are going to cover a few that will impact our members. So Tony, with that, I wanted to just start running down a list of those bills that they need to be aware of. We're going to start with the COVID-related medical liability reform legislation, which actually passed and was signed into law by the governor in the middle of session, which is kind of unique. But do you want to talk a little bit about that bill and its effective date and the impact it's going to have on orthopedic surgeons and other businesses in the state?
Sure. And again, thanks, Fraser, for having me. And thank you. It's been a privilege to represent the Florida Orthopedic Society over the years. So one of the issues for all healthcare providers for the 2021 session was the issue of liability protection as it relates to their service provided during COVID. At the start of session, there were two bills working through the process. One was for the business community, and there was a separate bill for the healthcare providers. The Senate thought it was important to combine the measure into one. And ultimately, that's what passed, one big package that covers both the business side of things as well as the healthcare services that were provided during COVID. What's important to note is under the bill, healthcare providers get specific protections. For example, it requires a plaintiff who files a COVID-19 related lawsuit to prove that a healthcare provider's conduct constituted gross negligence or intentional misconduct. So very high standard there. It also, under the bill, gave a healthcare provider stronger liability protections, requiring when the provider had substantially complied with the guidelines that were issued by any government group, that as long as they followed those guidelines, they had that extra protection. It also gave strong liability protections if you had to delay or cancel a medical procedure as a physician, or even a surgery due to those government issued healthcare standards. So those were the three main things as we went into the legislative session that we thought were important to have included in a COVID liability protection legislation. And those were the three things that came out. So that should give the protection doctors need as we see potentially more and more lawsuits coming out of the care provided during the pandemic.
So with passage of the bill, it really was a recognition that physicians in the state and hospitals and other providers were dealing with less than ideal situations during COVID. There was, of course, a lot of scientific literature that had not been developed around COVID. Also, the supply issue and availability of PPE. So talk a little bit about some of the conversations as the bill moved through session and some of those areas that the legislature really understood the restrictions with which physicians were working in the state.
So during the 2021 session, we thought it was important for legislators to understand that the care that was given at the beginning of the pandemic, in many cases, was much different than the care that was given at the end of the pandemic or during the pandemic. I wouldn't say end, I guess we still are under the federal emergency orders, even though the governor has removed the state emergency order that was in place. And the idea is, unfortunately, trial attorneys will always find a reason to take lawsuits. But how could we safeguard the physician when they followed all of the government standards that were out there at that moment in time? Because really, it's almost like a snapshot. So this legislation should do that, and also give them the protection of the higher standard in which has to be proven before a lawsuit can move forward.
Tony, switching gears a little bit, I want to talk about an issue that the legislature has actually addressed, I think, 2 or 3 years in a row now, which is non-opioid alternatives. There seems to be an annual cleanup of that legislation. So I wanted you to touch briefly on, what significant change is included in the bill that passed this year and is going to be taking effect.
Yes, Senate Bill 530 that passed this year was pretty much a glitch or cleanup bill. And it really was on behalf of our members who have moved toward more electronic delivery and patient portals. So this would say the non-opioid alternative form that you have to give your patients can now be delivered in an electronic format. So this came directly from our members who thought it was important. A great change, and also improve the check-in process for their patients. And also when they're prescribing the opioid and they need to give this pamphlet, it gives a streamlined process moving forward.
Fantastic. So legislation did not change the requirement that they provide the state developed pamphlet from the Department of Health. It just means that they can deliver it in both written and electronic format, correct?
Correct. So it allows it to be provided electronically or in a print. So you do have that option or that choice. Previously, it was only in the printed format. And the pamphlet still has to contain information on the use of non-opioid alternatives for the treatment of pain. And it also still must be provided when a patient will receive anesthesia, or it has to be provided when opioid medicines are going to be prescribed.
Talk about another cleanup bill now, which is the pelvic exam consent legislation. And this was a bill that passed last year as well and caused quite a bit of concern across the physician specialties because it impacted every physician. Orthopedics maybe is not as much as some of the other specialties. But the legislature did go back and clean up that legislation a little bit and address some of the concerns. So Tony, do you want to give an update of what the current legislation is around consent for pelvic exams?
Sure. And this is an example of when I say 2 things you never want to see made, and that's sausages and laws. So this was a sausage from last year that we turned into a meal and made it more palatable for everyone involved. Senate Bill 716, not only does it simplify the definition of pelvic exam, it also narrows the requirements to say written consent is required if a patient is going to be under anesthesia or unconscious, and then also clarifies that verbal consent can be obtained except for the following situations. It does now say for any of our on-call specialists that not only the care you give post exam in the emergency room is covered, but the actual emergency exam you give on the forefront is also covered. That was one of the dilemmas that was in place before, is kind of the chicken before the egg, making sure that both the exam and the care you give are covered and exempt from the written notice. And it also now says in certain situations, for example, your medical students, if they're doing a pelvic exam in the delivery room, they can do so. You can name all the practitioners on one form.
Like most legislative sessions, this year also saw quite a few scope of practice bills filed. Most of them, thankfully, did not move forward. So we got a little bit of break from some of the scope of practice expansion initiatives that we've seen over the last several years. But one issue did pass related to physician assistants. And the final bill ended up looking much different than the original filed language. But wanted to spend a moment talking with you about that legislation in particular and what impacts or slight changes our members will feel around their supervision of physician assistants.
And so true. The bill started out as a complete independence for PA. There were 2 versions. One would give them complete independence. The second bill would have mirrored what occurred last year with ARMPs, in which it gave them independent practice, but specifically in the area of primary care. The compromise that was reached is that now PAs can have a higher ratio of supervision with a physician. Previously, it was one physician for every 4 PAs. Now the supervision has been increased to one physician for every 10 PAs. Under the legislation, which was House Bill 431, it also allows a PA to sign and certify documents that currently had required a physician's signature. And some of those documents are Baker Act commitments, do not resuscitate orders, school physicals, and death certificates. What was excluded from the documents that a PA could sign was they can't use their signature on a medical marijuana certification. They can't sign workers' compensation medical examinations, which are required to determine maximum medical improvement. And as well as they cannot sign impairment ratings, all that, of course, under the workers' comp system.
Yeah. And I think that final point is pretty key for our members to remember too. No matter how many PAs you might be supervising, their engagement in the workers' comp system is still somewhat restricted.
And I will say too, what's important to note here, this is a physician's decision. We said, currently it was 1 to 4. Some physicians do supervise the whole 4. Some choose to do 1, 2, or 3. And same thing with moving up the ratio 1 to 10. There's nothing in the legislation that says you have to go to that limit. Really, this is about finding what works in your practice and what you feel comfortable supervising and being responsible for.
Yeah. And we have heard from some members that have concerns that their health system or employer may encourage them or incentivize them or force them, to use a different term, to supervise more than they're comfortable with. So obviously, as an organization, it's an issue we're going to have to monitor on an ongoing basis. We don't want physicians being stuck in a situation where their employer is forcing them to provide supervision that they don't think they can provide adequately. And again, as we've already heard about today, there's the opportunity to fix some of these issues moving forward. And that's certainly an area probably on this bill we'll need to monitor, just to see if the supervision of that many PAs does pose an issue for some physicians in some arenas or in some employment relationships. I wanted to shift gears to something that's maybe a little bit more positive news, or an issue that certainly has come more into the limelight during COVID around health disparities. I wanted to talk about a bill. And actually, the Florida Orthopedic Society did send a letter to the governor encouraging him to sign this bill into law. But it creates the Office of Minority Health and Health Equity, and it was an important initiative. During our annual meeting, our diversity committee had the Senate bill sponsor come and present during the annual conference. But wanted to have you explain a little bit about what that means from a state perspective. Putting some resources into looking into health equity and minority health.
Yes, and we're all acutely aware of the fact that minority populations in Florida experience higher rates of illness and death from conditions such as heart disease, stroke, certain cancers, diabetes, mental health, asthma, obesity, HIV. The list is quite long. So even though previously there was an Office of Minority Health already at the Department of Health, they kind of were a little inactive. They really had not taken the forefront in advancing programs on a statewide level. So with this piece of legislation, House Bill 183, it now gives an increased role of the Office of Minority Health within the Department of Health. And it requires them to develop and promote the statewide implementation of policy and programs and practices that increase health equity for racial and ethnic minority populations in Florida. It also requires the office to work with other state agencies, not just the Department of Health, but work across the board to improve the health outcomes for racial and ethnic minority populations. It also requires them to do some new data collection and development of health policy and programs that will also hopefully help eliminate some of the health disparities that these communities are seeing.
And then one final issue that we want to talk about today, Tony, is an update of where we are on the PIP issue in the state of Florida, our no-fault insurance program. Do you want to give us a quick update on where that debate ended throughout session and some recent activity on that issue from the governor's office as well?
Sure. And right off the bat, I'll say this is one of the few pieces of legislation that the governor did veto this summer post-session. Remember, what we were dealing with is a proposal by the legislature to repeal the PIP system, which is the no-fault system in Florida currently for auto drivers, and replace it with a BI system, or bodily injury. Of course, the Florida Orthopedic Society has always said that we support a no-fault system because it assures that the health care that's provided to an auto injury patient is compensated in a timely manner. And a BI system, we've seen where it was implemented in other states, would mean a delay in payment until the judicial process works its way through the court system and fault is determined. So our number one concern was safeguarding that delivery of care and making sure the physician is compensated in a timely manner. On top of that, too, we all know that post-auto accidents, that patients really do need that access to care, that many of these injuries require immediate attention. And what's unique is, and I would say in the orthopedic world, when you're talking about broken bones, in many cases after an auto crash, that's not where the fraud was occurring. And in fact, that $10,000 that was in the current PIP statute was enough to allow a patient in many cases to get the care they needed to eliminate the injuries that they received from that auto crash. So looking at what passed is really what would have been a move to BI. Thankfully, in the bill, we were able to safeguard some of the most important things as an association that we thought needed to be retained. One of it was a $5,000 physician set aside that's in the current statute that says for 30 days, $5,000 of the $10,000 PIP benefit would be reserved for those physicians that are coming in as on-call specialists. That was a big deal. We also wanted to see health insurance, let me say this, the advocates for a move to BI argued that the PIP coverage was duplicative for those patients that had health insurance. So we would have liked to have seen anyone that didn't have health insurance have a mandatory uptake of what's called med pay, or a set of money that's there available for a patient to access the healthcare system and those providers to get compensated. Instead, what we got was a compromise, but I think took care of much of the concern, and that would be drivers would automatically get $10,000 of a med pay coverage unless they opt out in writing. So the opt out in writing is important because it gave the insurance brokers the chance to say to the driver, do you have health insurance? Oh, no, you don't. Then you have to purchase this med pay component so you would have access to the care you need. Our number one concern moving forward, if the BI bill would have stayed, would be how, if a doctor knows they have to wait until fault is determined before payment, would that just push more cases or more arrangements under letters of protection, where the physician's providing care and knowing it could be much longer down the road before they're getting paid, and in many cases only collect pennies on the dollar. So thankfully the governor did veto it, but I must say it will definitely be a fight that comes back next year. We hope we can keep the reforms in any legislation that moves forward that I just mentioned. I will say probably the number one reason the governor did veto the bill, though, is the information that came out kind of later in session that any driver who was only carrying the minimum coverage currently and now would have to buy the BI coverage, it actually would be a substantial increase in their premiums. So I do think the governor was looking after that premium increase probably for the most economically distressed drivers out there. But moving forward, we'll have to balance that argument for premiums versus access to care and the need for physicians to get timely compensated.
So it is status quo in the state as far as our PIP and no fault situation. But probably the good news is the debate continues to mature. And I think some of the language that was put in the bill is a recognition that access to care is critically important for injured drivers, and the care that physicians and emergency physicians and orthopedic surgeons render is critically important to make sure it's readily available. So I think we see a maturing of that debate over time, which is good, and hopefully leaves us in a better situation where this bill is likely to be filed and heard again next year, correct?
Correct. And, in Florida, we're in a unique position because we have such a large number of uninsured. And so even though some might argue that health insurance is a duplicative coverage to, say, a med pay, in reality, knowing, I believe it's about 8 million people in Florida don't have health insurance. And you also have to look at the prevalence of high deductible plans. There's so many patients that have health insurance coverage, but can't really afford the deductible that is in place prior to them getting the care they need. So we think it's very important moving forward that there is a mandatory uptake of those patients who don't have health insurance. And in fact, in many cases, you have to ask under a BI system, it doesn't cover the at-fault driver. And also you're assuming, even though you might have health insurance, do all the people in your car have health insurance? So that med pay would cover not only the way I should say in the legislation that passed this year, but was vetoed by the governor, it would cover not only you, but those people in your car. And we feel that's important as well. I know as a carpool mom, sometimes it's important, I know my kids have health insurance, but do I always know that the other kids in my car, if there was an accident, would be able to access care that they need? So, part of it's educating. I think at the end of the day, some policymakers think a move from a no-fault system to a fault-based system from a policy perspective is a wise thing to do, because we are one of the last states that have a no-fault system. But ironically, if you look across the board to the other states that have passed a BI system, they've coupled it with other types of programs, whether a mandatory med pay, and that would make sure there was coverage there, at least for a segment of care directly after an auto injury crash.
Well, fantastic, Tony. Thanks so much for all that great information. Clearly, you had a busy time this year in Tallahassee. We appreciate your ongoing representation of the orthopedic community, and appreciate the hard work, and look forward to providing additional programming in the coming weeks about some other bits of legislative items or statutory issues that we just want to make sure our members are fully aware of. So thanks again for your time today.
My pleasure. Thanks for having me.